Right now, thousands of Singaporeans in Delhi are facing a health crisis that many didn't see coming. Singapore's High Commission has just issued an urgent warning that's making headlines across Asia. And if you have family, friends, or colleagues in India's capital region, you need to hear this immediately. Why are diplomats telling elderly citizens to stay indoors? What's happening with Delhi's air that's so concerning? The answers might surprise you, and more importantly, they could help protect someone you care about from serious health risks that experts say are preventable with the right precautions. If you find this information valuable, please hit that like button and subscribe to stay updated on important health and safety advisories. Share this video with anyone you know in Delhi or planning to visit, because this information could make a real difference. Singapore's High Commission in Delhi has recently issued a critical advisory that deserves our immediate attention. The advisory specifically warns Singaporean citizens, particularly elderly individuals and those with pre-existing health conditions, about the severe air pollution currently affecting Delhi and surrounding regions, according to reports from the Times of India and other reputable sources. The air quality in Delhi has deteriorated to alarming levels, prompting diplomatic missions to take the unusual step of issuing formal health warnings to their citizens. Let me explain what's actually happening on the ground. Delhi and the National Capital Region have been experiencing what environmental experts describe as hazardous air quality levels. Research indicates that during certain periods, particularly in winter months, a combination of factors including vehicular emissions, industrial activity, construction dust, crop residue burning in neighboring states, and weather patterns create what meteorologists call a pollution trap. The cooler temperatures and low wind speeds prevent pollutants from dispersing, causing them to accumulate at ground level where people breathe. The Singapore High Commission's advisory isn't an overreaction. It's a measured response based on scientific data and health assessments. Analysts suggest that diplomatic missions monitor air quality indices closely and issue advisories when conditions reach levels that could pose health risks to their citizens. The specific mention of elderly individuals and people with health conditions reflects what medical research has consistently shown about vulnerability to air pollution. Studies indicate that these groups face higher risks of respiratory complications, cardiovascular stress, and exacerbation of existing conditions when exposed to poor air quality. So what exactly is the High Commission recommending? The advisory encourages Singaporeans in the affected areas to remain indoors as much as possible, particularly during peak pollution hours, which environmental experts say typically occur in early morning and late evening. The recommendation to wear masks when venturing outside isn't about causing panic. It's about practical protection. Public health specialists explain that properly fitted N95 or similar grade masks can filter out fine particulate matter that poses the greatest health risks. These tiny particles, measuring 2.5 micrometers or smaller, can penetrate deep into the lungs and even enter the bloodstream, according to medical research. Understanding the science behind this advisory helps us appreciate why it matters. Air quality is measured using something called the Air Quality Index, and experts warn that when this index reaches certain thresholds, it moves from being merely uncomfortable to potentially dangerous. The pollutants of primary concern include particulate matter, nitrogen dioxide, sulfur dioxide, carbon monoxide, and ground-level ozone. Research indicates that prolonged exposure to these pollutants can trigger a range of health issues from minor irritation to serious respiratory and cardiovascular problems. For elderly individuals, the risks are particularly concerning. Gerontology experts point out that as we age, our respiratory and immune systems naturally become less resilient. When you combine this with poor air quality, analysts suggest the risk of complications increases significantly. Similarly, people managing conditions like asthma, chronic obstructive pulmonary disease, heart disease, or diabetes need to be especially cautious. Medical professionals explain that pollution can trigger acute episodes in these conditions and potentially lead to hospitalizations in severe cases. The Indian government and Delhi authorities have been implementing various measures to address air quality concerns. These include restrictions on certain activities during high pollution periods, promotion of public transportation, regulation of industrial emissions, and public awareness campaigns. The advisory from Singapore's High Commission works in conjunction with these efforts, providing specific guidance to Singaporean nationals while respecting the host country's ongoing initiatives to improve air quality. It's worth noting that this situation isn't unique to Delhi, and it's not a permanent state either. Environmental scientists explain that many major cities around the world face air quality challenges, and seasonal variations are common. What makes Delhi's situation particularly acute during certain periods is the unique combination of geographical, meteorological, and socio-economic factors. However, experts also note that when conditions improve, usually with changes in weather patterns or when mitigation measures take effect, air quality can recover relatively quickly. For those currently in Delhi or planning to travel there, what practical steps should you take? Health advisors recommend checking air quality indices daily through reliable applications or websites. When air quality is poor, minimizing outdoor activities, keeping windows closed, using air purifiers if available, and staying hydrated are all sensible precautions. If you have elderly family members or those with health conditions in Delhi, experts suggest maintaining regular communication and ensuring they have adequate supplies of any medications they require. Analysts also recommend having contingency plans, knowing where the nearest medical facilities are, and keeping emergency contacts readily available. The broader conversation about air quality isn't just about immediate advisories. It's about understanding long-term health implications and supporting sustainable solutions. Environmental researchers emphasize that addressing air pollution requires coordinated efforts across multiple sectors including transportation, energy, agriculture, and urban planning. As citizens, whether we're in India, Singapore, or anywhere else, staying informed and supporting evidence-based environmental policies contributes to healthier communities for everyone. This advisory also highlights the important role that diplomatic missions play in protecting their citizens abroad. When foreign missions issue health advisories, they are drawing on expertise from environmental scientists, medical professionals, and local authorities to provide their citizens with actionable information. It's a collaborative approach that respects local governance while fulfilling the responsibility to keep citizens informed about potential health risks. If you found this breakdown helpful, please don't keep it to yourself. Share this video with your network, especially anyone with connections to Delhi or the National Capital Region. Subscribe to this channel for more important updates on health, safety, and community advisories that matter. Drop a comment below if you have questions or experiences to share about air quality concerns. Your engagement helps this information reach more people who might benefit from it. Remember, staying informed is the first step towards staying safe. Take care of yourselves and look out for one another, especially our elderly community members and those managing health conditions. Together, we can navigate these challenges with awareness and compassion.